During a public health emergency, it's very important that people know how to respond and to protect themselves properly. So the authorities, the public health authorities, need to provide messages to people to enable them and empower them to do this. One of the problems with Zika is that the messages that people need to protect themselves from mosquitoes, which involve things like bed nets or wearing long sleeves or repellent, they're effective, but it's very difficult to be completely effective and over a long period of time. So that's one problem. The other problem with Zika is that for a woman who is maybe thinking of getting pregnant, it's very difficult for her to know what to do. There's a real anxiety and a concern. So how do you actually make a message that will be meaningful and actionable for a woman who's thinking about getting pregnant? So basically this project is about trying to address those issues. And what we want to do is to contribute to, hopefully, future rounds of messaging for Zika in Brazil by asking, first of all, women of reproductive age about the problems and concerns that they have with Zika and the messages and their understandings of the messages and how they've managed to respond to them. So we want to speak to the women themselves. We want to speak to their male partners because there is, of course, the risk of sexual transmission. So we need to know about men's willingness to practice safer sex and so on. So that's at the community level. But we also want to understand the issue from the point of view of healthcare providers, from perhaps religious leaders, local level political leaders, and civil society. We want to get that perspective to understand the dynamics between those two groups. And then the third group of people we want to involve in this process is actually the people who have been making the messages. And this is very important because if we can understand the challenges they've had in making messages for Zika in terms of grappling with designing messages based on incomplete knowledge, which is one of the problems with Zika right now, we can hopefully contribute to the process of making better messages in the future. And if we involve these people, then they will also feel that they have hopefully a degree of ownership over the messages that we can produce, or at least some of the ideas we can produce. So we're going to be working in two areas for sure, and possibly a third, but we're not sure at the moment. But we're going to be working in Salvador, in Bahia state, and we're going to be working in a city near Sao Paulo called Jundiaí. And we're going to be doing very similar approaches in the two areas to try and have comparisons between these two socioeconomically and epidemiologically distinct areas. Salvador has had more cases of Zika. At the moment there are cases in Jundiaí, but not very many. So in that sense, the awareness of the problem will be different in the two places, and we want to try and pick up on that because that will help us to target messages more effectively if we know how people are experiencing the epidemic at the moment.